Hi, I'm Dr. Matheson Harris in Salt Lake City, Utah. Skin cancer of the eyelids is relatively common, especially in the West, where lots of us spend time in the sun. The eyelid skin is the thinnest and most sensitive skin on your body. Sun damage and other environmental toxins cause the skin to age and can cause cancer. The presence of a bump or growth on the eyelid that is enlarging, bleeds, or forms a scab should be looked at by a medical doctor trained in recognizing these types of growths. Basal cell skin cancers represent 90% of eyelid tumors and grow slowly over months to years. They usually appear as a pearly nodule or bump that eventually starts to break down and bleed or scab. Despite being a cancer, these tumors don't spread to distant areas, but mainly just continue to grow and infiltrate the surrounding tissue, causing a lot of damage. They can be cured by a simple surgical removal if they are caught early. Squamous cell tumors are less common but more aggressive. They can eventually spread to other parts of the body. Early detection and removal are key. They will appear as a rough, crusty, or red spot where the skin is changing or breaking down. These are harder to spot sometimes, so it is important to see your doctor regularly if you have a history of skin cancer so they aren't missed. Melanoma is the least common but most dangerous eyelid skin cancer. It usually appears as an irregular brown spot. If left to grow, it can invade into the deep tissues and spread to other parts of the body. Melanoma can be lethal, so have any suspicious spots checked out as soon as you notice them. Skin cancers often need to be removed by a surgeon who can also reconstruct the eyelid or area where the tumor was removed. We often perform small tumor removals in the clinic, but sometimes we must use a surgical facility with an on-site pathologist who can immediately examine the specimen to ensure the whole tumor was removed. Other times we work together with a dermatologist specializing in Mohs surgery, where they completely remove the tumor and we reconstruct the defect they create. After skin cancer removal, you'll likely have stitches. They will normally dissolve on their own, but sometimes we'll remove them in 2 to 3 weeks after surgery. In some cases, we have to sew the eyelids together temporarily. In this case, you'll receive special instructions on how to care for these stitches. The most important thing to remember is to avoid touching the incision as much as possible to avoid infection and accidental breakage of the stitches. Always have any suspicious growths checked out while they are small. The larger they get, the bigger the surgery to remove them and close the defect. If you have any questions about skin cancer, email me directly or call our office for a visit. Thanks for visiting Utah Eyelid and Facial Plastic Surgery. We look forward to helping you feel and look your best.